Good afternoon, everybody. I'm going to start today with just a little update on the weather. As you all know, early this morning we had some very heavy thunderstorms and torrential rain that fell across much of our state. Ironically, some of the areas in New Orleans and in that vicinity experienced much more severe weather today than they did with the tropical storm over the weekend, with more than 2.5 inches of rain falling in a very short period of time. The National Weather Service had issued a flash flood warning as street flooding did in fact become a problem. And I mention this today just because it's a reminder that every day in Louisiana, especially while we're in hurricane season, we can face severe weather and flooding from afternoon thunderstorms and so forth. So I would ask everyone to be alert to that. Make sure that you get a game plan. Go to getagameplan.org to help you prepare for an emergency. On the other side of the rain, for the next few days at least, we're going to have cooler temperatures and lower humidity, and it's actually going to be pretty nice outside. And one of the things that we're encouraging people to do in the midst of this public health emergency, this pandemic, is to make sure they take advantage of being outdoors. And this will be a good weekend to do that, although there's still rules around enjoying the great outdoors during this public health emergency as well. And anytime you're in close proximity to others within 6 feet who are not part of your immediate household, please make sure you have that mask on. And try to not get closer than 6 feet anytime that you can possibly avoid that. With respect to COVID-19, today we are reporting 418 new cases. That's a total of 44,030 since the inception. Sadly, there are 11 new deaths reported today, which brings the total number to 2,855. 549 COVID patients are hospitalized across the state of Louisiana. That is 19 fewer than yesterday. With 72 of those on mechanical ventilators, that is 5 more than yesterday. Of the tests that were administered to inform today's case count, there was a 6.5% positivity factor. So 6.5% of those tests were positive. And that was actually on 6,452 tests. Now for the update on contact tracing between May 15th and June 9th. During that time, contact tracing teams statewide reached out to 97% of those who had positive cases and to 95% of the people identified as having come into close contact with those individuals who had positive cases. So that is good news, and we are able to reach out. We are meeting our capacity goals. More than half the people who have been called have answered. And obviously there's a continuous effort to call and in some cases write letters to those people that we haven't been able to reach. LDH is making a concerted effort to get in touch with those who are positive and with those who may have been exposed to them. And in many cases, people are simply missing the call, or I suspect they don't recognize the number and they just choose not to answer. As a reminder, the number is 1-877-766-2130. 877-766-2130. If it comes up on your phone, please answer. And if you show that number as being associated with a missed call, all you have to do is call it back. And we're asking people to do that. Contact tracers will ask you questions if you've tested positive or may have been exposed to someone who did, so that they can better give you guidance to protect yourself and your loved ones. But also, if you don't have the resources that you need to self-quarantine and you need some help, you can get some help from those same individuals as well. That help might be around getting tested yourself, or it may be around finding masks and so forth. I can say they've actually made 466 referrals to date on those calls, and the most common items that have been requested by the individuals have to do with masks and cleaning supplies. I do want to give you a shout out to the nonprofit Love Our Community in Lafayette, which has been supplying free masks at testing sites along with educational pamphlets about how people can stop the spread and the importance of self-quarantining when it is called for under the CDC guidelines. Resource coordinators have been given these packages to contacts and cases that request the need for masks, and now they've committed to giving another 40,000 packets. At this time, I can tell you we are not seeing a spike in cases. There are a few regions that continue to concern us, most notably Region 8 up in the Monroe area, but also Regions 5 and 6. And I think suffice it to say, or in short, 5 and 6 have slight increases in cases and hospitalizations, and in 8 we're seeing slight increases in cases. Hospitalizations most recently have been flat. But there's a lot of factors to consider, including the increased testing specifically in congregate settings. So that does impact case growth and the percent positivity. We expect a higher percentage of lab results to turn out positive when we do mass testing in congregate facilities. I will ask Dr. Bu to come up when I'm finished and before I take questions, and he'll get into a little more detail, I think, on those 3 regions. But I do want everyone to understand that while the state is obviously doing much, much better, and you heard me give the hospitalization number a while ago, and the percent positive overall is decreasing. Sometimes if you just look at the numbers from a high altitude, it obscures what's going on in certain parts of the state, and that would be the case. So if you're in the Lake Charles area, if you're in the Alexandria area, if you're in the Monroe area, we do have some concerns about those areas, but we're asking those people to do the same thing that we're asking people all across the state of Louisiana to do, and that is to make sure that you're following all of the protocols that we have in place. Wear your mask when you're out in public, outdoors or indoors, and in close contact, proximity to people who are not in your immediate household. Make sure that you keep your 6 feet distance. Make sure you're washing your hands frequently and so forth. Stay home when you are sick. You know, those are the things that everybody has to do. It's extremely important to note that we just can't get complacent. And I think that this is perhaps just part of what may come natural to some people. As you ease restrictions, they say, well, the problem must be gone. No. If the problem was gone, we wouldn't ease restrictions. We would remove restrictions. Just like the rest of the country, we still have COVID-19 in every single community across the state of Louisiana. And if we let our guard down, we can easily see those cases start to rise, and then we have to entertain additional measures, and nobody wants that to happen. We've been in phase 2 for less than a week now. I can tell you the Department of Health is closely watching case counts everywhere in the state, trying to figure out what those cases mean. Does it suggest community spread or does it not? Are they actually producing more people going to the hospital? What's the acuity level of the people in the hospital, and so forth? And there's a lot of information that we are paying close attention to inform our actions. Do want to talk a little bit about PEBT as well. The deadline for pandemic EBT applications, the federal program that provides food benefits for students who receive free or reduced price school meals. That deadline has been extended to Monday, June the 15th. As of Tuesday afternoon, more than 250,000 parents had submitted PEBT applications for more than 440,000 eligible students. Parents are receiving their first batch of benefits this week. Be alert when checking your mail. The cards are arriving from a contractor in a plain white envelope with a return address of Austin, Texas. So don't throw that away. If you haven't applied and you believe you're eligible, again, if your child receives free reduced meals at school, you can apply to the Louisiana Department of Education on their website at www.louisianabelieves.com. Finally, LDH, in collaboration with the Health Science Center at LSU, Teasdale Design, and Revel Ray Labs have designed and today are launching the Louisiana COVID-19 Get Back to Work Safely tool. This quick survey will help you identify your personal risk of severe illness from COVID-19 and provides recommendations on how you can keep yourself and your loved ones happy. You can find the survey by visiting ldh.la.gov. Scroll down and click on the box that says Defend Against COVID-19. All details are kept anonymous, won't be used for any purpose other than to simply give you some advice if you fill out that survey about what you can do to stay safe. As I mentioned Monday, starting next week, we're going to move to once-a-week press briefings on COVID-19. We anticipate that they will be held on Wednesday afternoons. We probably will keep this 2:30 time slot. Obviously, if that changes, we're going to let you know. And again, I would just remind everybody, there's still a lot of COVID in Louisiana. We're reporting 418 cases today. You can look at the total, if you go back to the dashboard, you can look at the total cases since we've started. We're now at 44,030, and with 33,000 of those recovered, that suggests 9,000 or so active cases, but those are only among the tested population. Asymptomatic people who may have it and be contagious are not being tested, and obviously people are spreading this 48 hours before they become symptomatic. So the pre-symptomatic spread is also a big issue. So we have a lot of COVID-19 in Louisiana, and while we're certainly doing better than we were a couple of months ago, if we let our guard down, if we become too lackadaisical, if we stop doing the things that the CDC has recommended, that the White House Coronavirus Task Force has recommended, that Dr. Biu and Dr. Guidry and others have recommended, we can see those cases go the wrong way. Hospitalizations go the wrong way, and obviously we don't want that to happen. So I'm going to ask Dr. Biu to come up and talk just a little bit more about those three regions. If you've got questions about those regions, please ask him at that time, and then when he's finished, I'll come back up and take your questions.
Thank you, Governor. So I'll start where the Governor left off and just again emphasize that we still have significant levels of COVID in the state. As the Governor just emphasized or just stated, we know that of the cases we're actually tracking, at least 9,000 plus of them are active, and that is a proportion of the total cases, people who haven't been tested, people who don't have symptoms, that are out in the community potentially and at risk of continuing the spread of COVID-19. So we watch data very carefully based on the case data that comes into the state so that we can understand where we're starting to see challenges. Since the beginning, when we've been talking about the gating criteria that we track, looking at people who have symptoms of COVID-19, the cases that we're identifying in the community, and the people who are having severe enough COVID-19 that they're having to be in the hospital, we look at all of that data to understand what that means for the state, what that means for epidemic. One of the reasons we weren't able to move into phase 1 as early as we might have wanted was that we were still seeing high levels of COVID in the community and concerning trends of rises in cases and hospitalizations in several regions. One region that we've watched since the beginning of concern for us is the Greater Monroe area, where we've seen a consistent increase in cases and a consistent increase in hospitalizations. And remember, what we've been talking about over time is that as we increase testing, we should fully expect that we see more cases. But a concerning trend would be where cases and hospitalizations are tracking each other. Because whether you knew about your status yesterday or not shouldn't change how you feel and if you're sick enough to be in the hospital or not. So it's kind of an objective measure for us on how the epidemic is in that region. And what we see is that consistently, now more than a month out from when we've started to report this information, in the Greater Monroe area, we continue to see spread in communities. The silver lining that we have is that we have really been surging testing in that region, specifically with the help of GOSEP and the National Guard, really increasing the number of tests that are available in communities outside of Monroe, looking at the Delta parishes, which early on did not have a lot of access to testing. That's helped us find a lot of people who are COVID positive, and importantly, through contact tracing, give them information about how to isolate, how to quarantine if people are contacts of those people, to help us really start to get control over the amount of spread that's going on in that community. As the governor noted, we're starting to see some fluctuations, but some trending of plateaus in hospital levels, hospitalizations in Region 8. Those numbers have never been so alarmingly large that we were concerned about hospital capacity, because the leadership in that region has done a great job of managing their capacity. But they were slow and consistent, and again told us that there was continued spread and a need for us all across the state, but certainly in those regions that we have concern about, to take steps to reduce the spread of COVID-19. More recently, we've seen the same trend in Region 6 in the greater Rapides area in Cenla. Similarly, seeing a trend in increasing cases as we're diagnosing people, and an increase in hospitalizations. When we look at what's causing the increase in hospitalizations in those two regions, we definitely do see increased numbers of people from congregate settings, from nursing homes in the hospital, averaging somewhere between 40 to 60%, depending on which hospital you're talking about in these areas, could be coming from those congregate settings, where we're seeing that there's continued spread in those facilities. That's one of the reasons that under the governor's direction, we've been surging our ability to provide even more support and testing to all the nursing homes across the state. And that's so that we can understand the size of the challenge they're facing, give them good public health advice on how to identify, isolate, and really stem the growth of cases in those facilities. Because as we've said before, those facilities present the greatest risk for transmission, because people are living in close proximity, as well as the greatest risk for poor outcomes, just because of the nature of the individuals that live in those congregate settings, older individuals over 65, and people who often have not only one, but multiple underlying chronic conditions, which again, when you look at our mortality data, the death data that we put on our website, those are the individuals that are having the hardest times with COVID. Most recently this week, as we've been looking at the data, we've seen a similar trend in both cases and hospitalizations that's increased in Region 5. That's the greater Lake Charles region in the southwest of the state. And again, concerning, because though some of that is driven by increased testing, when we look at cases, we see a significant increase in the number of hospitalizations, moving from about 4 people admitted in the previous weeks to almost 20 in this week. And again, to get admitted, it's not just a matter of having a COVID diagnosis. You have to be deemed by a medical professional ill enough to warrant to be admitted to the hospital. So it really does serve as a somewhat objective measure. Similarly there, we do see that some of the people who are being admitted are from congregate settings, but if we look at Regions 5 and 6, for instance, in the last week, almost 80 to 90% of the admissions that are being seen in the key hospitals that we're looking at in those regions were people in the community. And so what we can see now through contact tracing are clusters that are developing in communities across those regions, across the state, but I'm focusing on those regions, 5, 6, and 8, which involve people coming together often, whether it's living in close proximity, perhaps in a trailer park, or coming together for card games, as we've seen in regions. People who may or may not have been wearing masks coming in close proximity, and so we keep coming back to the messaging that we've been giving since the beginning, that as we move from phase 1 to phase 2, as we re-engage aspects of our economy, as we try to re-engage the as close to normal way of life as we can, a new normal, we need to keep in mind we ourselves individually have to make changes in the way that we go about our daily lives to protect ourselves and to protect our communities. And that means staying at home if you're sick. It means wearing a mask, and we're not seeing nearly enough people wearing masks right now. Not just for your own health because other people are wearing masks around you, but doing your good part as a neighbor to wear a mask to prevent the spread to others. And it means washing your hands, and just because you can now go to more places, just because we are able to re-engage more aspects of the economy, does not mean that that's where you should spend all of your time. And just because a restaurant is now able to operate at 50% capacity doesn't mean that if you walk in and you see nobody's wearing masks, and you see everybody's clustering and congregating and not keeping 6-foot distance, that it's safe for you to be there. You have to take it upon yourself to make sure that you're policing where you go and how you interact with people. And though somebody's your good friend, if you haven't seen them in several months, this is probably not the time to suddenly go and sit in a room with them together and play cards, as they may themselves have been exposed to people you're not aware of who have COVID and transmit it to you. So we need to continue to be vigilant until we really drive cases down to where we've almost extinguished COVID. We need to continue to wear masks anytime we're around people who are not in our household. Within 6 feet, certainly. But again, just get in the habit of wearing masks, indoors or outdoors. And again, we need to do our part to work with the contact tracers as they're giving us advice on how to remain safe. Both individuals who are newly diagnosed, understanding how to protect our families by isolating. But then if somebody reaches out to us and we feel fine, but we were told we're a contact, understand that you're being advised and asked to stay home under quarantine for 14 days for your own health, because you could certainly develop symptoms and illness from COVID subsequently, but also importantly for the health of the people you care about around you. As the governor noted, we've tried to put more of this information out. I've been very happy to have the help of LSU Health Sciences Center, Teasdale Design, and Revelry Labs in putting together the screening tool that's now available on our website that you can go individually through and understand what's your risk. Because even as we open up a restaurant or a sector, that doesn't mean that your particular risk from COVID-19 has changed. And so we want everybody to understand the personal responsibility aspect of this. Go through that tool, that app. It's very quick, and you can understand what your individual risk is. And it also gives you helpful information about how your individual risk, which could be low if you're young and healthy, translates to potential high risk for people around you. If you're living with your grandparents, or if you're living with somebody who has significant underlying conditions, be mindful of how your risk of contracting and spreading COVID can affect the people that you care about around you. You want to make sure that you're empowered with that information. And so with that, I'm happy to take specific questions. Sam.
So you guys have indicated, when we see these rising cases and, they outpace the number of tests, right? So, there is an increasing cases that, many of these may be congruent studies
Mm-hmm.
to the community. Is the state at any point going to start releasing that breakdown so we can do that type of analysis of when we see new cases, if they're all coming from congruent studies, for instance, it's not a risk to the public?
So we certainly can consider it. I'll say, from the beginning, we've been consistent in two things. One, wanting to be as transparent as possible about our data, but two, wanting to make sure that what we show you and share with you, we're able to stay on top of, that we're able to do consistently and accurately. So say, for instance, today of the 418 cases, we know that around 11% of them came from congregate settings. So that's a significant chunk, but that's only 11%. That data usually takes us having a specific check-in and pulling data from our contact tracing database. So it's not something yet that we have automated enough that on a daily basis we could provide. But we are continuing to talk internally about how can we provide you and, importantly, the general public with more information so that you can see that, yes, we are increasing tests. Yes, the percent positivity is coming down, but test counts are staying high. Test counts are still in the 400 range. And again, today, 11% of those were from congregate tests, but that's only 11%. And so what else remains there is community spread, sometimes clustered, sometimes not clustered.
So it took a bit of lead time to get the testing materials required to Louisiana up to 200,000 per month. Are we in negotiations with federal suppliers to get more testing capacity at the end of the month when those run out?
Well, so the federal government has continued to commit to provide us that support, especially on the specimen collection kits, and this is both the swabs as well as the viral transport medium. I believe that's been extended out through the end of the year at this point. And part of that is also that the federal government has been working hard with a variety of providers, not just the specimen collection kit producers, but also the producers of the testing platforms that we use to actually perform the tests, really trying to communicate with them the needs that the states have, and then communicate with us the plans for continued expanded capacity. As you know, maybe 2 weeks ago now, we sent in our testing plans for the state covering May through June. Actually, our testing plan covered through the end of the year to the federal government, talking about all the partners that we work with around the state and our plans to continue expanding capacity. We understand that one of the reasons that the federal government wanted that information and the type of information they wanted was to understand what are the platforms that are being used in Louisiana, and then feed that into larger discussions about national supply chain. So I think, given that, I think we're going to continue to see expanded capacity. What I'll say is there's also a need to shift over time, understandably, from a governmental-run testing system to one that really leverages, like you do for almost any other healthcare test, the healthcare sector. And so that's been a part of our plan from the beginning. We've brought in private labs, our healthcare systems, but also academic labs and people who set up new testing labs. And we've been coordinating since April on what our strategy was in the long term as a state. And that strategy is not just relying on the federal government or just relying on the state government. It's about how can we make sure that our community clinics have the capacity to test? How can we make sure that our hospitals have the capacity to test? And so we'll continue to do that. And you know, the other point that we've made before just on numbers is that the goal with getting to 200,000 tests was that we knew we had many, many more places we hadn't reached. We hadn't yet reached 2% of every parish's population. We've exceeded that. We hadn't yet been able to test everybody in the congregate settings that we need to. We're making great headway there, and we want to continue to work towards achieving that goal. We wanted to surge testing in our African American community. They were bearing more than 50% of the burden of cases, yet represent around a third of the state's population. So what we've done in May and in June is getting us to where we need to be for that baseline capacity. But if we can turn around these trends in 5, 6, and 8 and make them look like the rest of the state, and we continue to see cases go down, we don't want to do 400,000 tests, 500,000 tests, however many tests, just for the sake of doing tests. Our testing goal will be driven by the amount of COVID in the community that we need to identify, and that's where we get to percent positivity and the like.
A few minutes ago, a pretty blunt statement about the state not doing a good enough job wearing masks. That message from you today, what's informing that around the state? Are you just seeing it, hearing it, getting data? Kind of what drove that pretty stern assessment today?
Yeah, I mean, I live in New Orleans, and I'll tell you, I see a pretty good amount of mask wearing where I am. When I live in Baton Rouge, I live in state buildings where I see a fairly good amount of mask wearing. But we have a regional team that's in every part of the state, and they are not only in jobs looking at public health policy. They go about their daily lives in places like Alexandria or Lake Charles or any number of communities. And what we hear over and over again is really inconsistent mask wearing, if not worse. There's recent data even from self-survey that shows people are still saying, there's a good chunk of people, maybe a third or more, that are not yet wearing masks themselves. So I think part of it is just we can see it objectively. We haven't done a formal survey of percent mask wearing, but we know that the people that we've mandated to wear masks right now are the people in the business sectors that want to open up and be successful. And we have not mandated that the community wears masks. All we can do is ask really adamantly that people wear masks to protect themselves. Leo.
Specifically, a recent I talked to a nurse about that, and they said that the nurses know the pandemic has certainly reached there. Do we have any idea of what could be the underlying cause of this? Or is the testing just now reaching there?
So Region 8, and you remember the early days of the epidemic, I think for a while, and I may be wrong here, so I don't want to upset anybody in Tensaw, but I think Tensaw might have been the last parish where we had a case convert. I may be wrong there. But we knew that in that region, we just did not have the access to testing that we needed. And so we've been trying for some time to get testing up there. The last 2 weeks, we've been having support from the National Guard doing mobile community testing. Even before that, we had LSU, Shreveport working with the hospitals in Region 8 to really expand testing. All of that has meant that we see more cases. And so part of what I would imagine people are reacting to in that area is that, yes, many more people in a nursing home are now being told you have COVID-19. I'm not convinced at this point that there's actually been a change in the amount of COVID-19 in those nursing homes. Certainly it probably has continued to expand because if you're not testing, if you're not cohorting, you're going to get spread. But I don't think there's anything unique about what's going on in that region other than for a long time it was a region that we didn't have the access to testing. And that's still some of what we see in Region 6. The level of testing in Region 6 is probably half or less of that, less than that of Region 8. We continue to try to expand testing there. But again, that can't be just a state-run function. We need all of the healthcare sectors, and we need the nursing homes to do this testing internally. We know that even as we offer them opportunities to test, not all of them are taking us up on that offer. And we need them to partner with us on this work. Sam?
The state is reaching less than half, I think, of contacts, and these contact tracing a little more than half of contacts, and then less than half of the infected. Is there a goal you guys are trying to reach on what percentage of people you're actually successful in reaching?
So our goal, and just to give a little bit more data there, when we look at how we can reach people, I think what you're hitting at is that there's a significant number of people, a little under half, but a significant number of people who we do not get adequate information when we're told that they're a case to be able to reach them. And that's concerning to us, because if we can't reach them up front, that's a problem. The good news is, and where our goals are largely structured, is that when we do have that contact information, we essentially reach out to everybody. 97% is pretty close to 100%, depending on any given time. There's going to be a small number you haven't called yet at that moment that we check. But we're essentially able, we have the capacity with the 4 call centers, with the trained contact tracers across the state to reach out to everyone. We're concerned, though, that as we try to do that, sometimes, again, the contact information that we have is not good, so it's a number that never answers. Or people perhaps are seeing this number and wondering if it's a telemarketer, though it does say Louisiana Department of Health. Or for whatever reason, they're anxious about what that conversation is going to be like. And all I can do is continue to stress that this is a private conversation that's really more about giving you information, about making sure that you understand what it means to be COVID positive, what steps you can take to protect the people around you, to help protect our communities, and importantly, as I think the governor might have stressed, to get you the help you need to be successful in isolating. So we've served over 466 individuals with resources that they needed to stay successfully at home. And that doesn't mean that you have to be homeless for us to give you services, or you have to need us to deliver daily meals for you to need services. I mean, the majority of people that we've been able to serve have needed things like cleaning supplies or masks. And as you heard through generous contributions, we've been able to provide those services. So answering the phone is not only critical to help the state, it also helps you because you're going to get more information that's helpful to you. You're going to get access to resources that can help you serve you as you're staying at home. And we want to reach the same for contacts. As you give us information on contacts, our goal is to reach more than 75% of those contacts within the next 48 hours. Right now, given the volume of contacts we're seeing, we're reaching way more than that. I think it's north of 90% within 24 hours because, again, we've got the capacity as a state. We need the participation from folks as a state.
I guess I'm just wondering,
What's the participation level that if we continue to see about half of people not pick up the phone, does that make the program ineffective in the long run?
So, I mean, I think that the easy answer is yes, it will not be effective if we can't reach people to tell them. We know that anybody who's getting a COVID positive test should be informed by their provider, and healthcare providers are going to be able to tell somebody, listen, this is what's going on with COVID, you need to stay home, you need to isolate. That healthcare provider may not have the time or the knowledge of the resources that we can give somebody to be successful in staying at home. So if you tell somebody to do something like you need to lose weight, but we don't tell you how you can do it, we don't give you support to do that, I shouldn't expect that you're going to come back to my clinic in a month having lost weight. What we can do through our contact tracers is say, we need you to stay at home, and I can help you do that. So people know that they need to stay at home because their providers are telling them. What we're able to add to that is the resources to make that successful and help us then inform other people about how to be safe as well. So I can't give you a percentage, Sam, on what number I think we need to reach in order for us to continue to get cases down. I can tell you that I think 50% is less than what we want, and I'm concerned that we're seeing a rise in cases in regions of the state, even though we have capacity to reach out to folks that we have contact information with. Any other questions? Sorry, go ahead. Oh, okay. Okay, last one. I didn't get paid that one day, so
I have a large number in the Hispanic community play soccer. And in phase 2, the soccer is allowed to start or no?
So the specific questions about soccer, and I'll tell you off the top of my head, I don't know where we stand on soccer. What I'll tell you is we do not have contact sports in phase 2. And the idea is, again, we've got 9,000 cases. We're excited that people want to get out and exercise. Right now, we're asking you to do that in non-contact, individual ways to protect you and to protect your family. And especially when we're talking about the Latinx community, we know that there is a lot of COVID in the community that's not being tested for fear of policing of immigration status, for fear of the public charge rule that's being misinterpreted as somehow precluding you from getting COVID testing. And to be clear, the public charge rule does not implicate testing for COVID for a variety of reasons. We know that we're not reaching into that community as much as we want. And so one thing to think about beyond the recreational sports is how can we get positive messages into the community about knowing your status, keeping everybody healthy, and getting tested. And we want to make sure everybody knows that testing is available to everyone regardless of their ID status, and we should be taking advantage of that.
I'm sorry. In Region 1, we saw a surge with the numbers of Latinos being affected with COVID. How is it looks in the other regions?
So I think it depends on the population in that region. What I can say is when we look statewide at the Latinx community, we see that overall a relatively small proportion of the population that's being tested is from the Latinx community. However, when we look at patients who are testing positive, so people who are getting tested but are positive, it is a significant proportion, nearly 50% of individuals who are being tested in some settings. That's very concerning to us. That's not something specific to the Latinx community. I think it has more to do with the structures in which those communities are existing. And it's the same when we talk about the challenges that we face in the African American community. We've been saying it for a while, and we have now even more evidence that structural racism is deadly. And this is another example, whether it's COVID-19 or other settings, that we need to try to address that structural racism rapidly because it's going to have an impact on the rates of mortality and illness in those communities. So we'd again encourage positive messaging around getting people tested because that's how you empower yourself to protect your community. Thank you.
Thank you, Alex. At this time, I'll take your questions as well. Yes, sir.
Obviously, in your prepared remarks, when talking about not lifting restrictions, obviously, because COVID is still very much in this state, pretty direct, stern, Dr. B with the mask wearing, pretty blunt, a little bit different vibe we haven't seen in several weeks from you. Not to say you've been lackadaisical, but that was a pretty stern message. Why all of a sudden trying to get people's attention that way?
Well, because if you deliver the same message every day in the same way, you know, it's not going to be received. And so you kind of pick your spots, number one. Number two is, over the last couple of days, I've had a lot of people literally ask me, and this is just about verbatim, do you think it's going to come back this fall? Well, it hadn't left. And I don't think it's going to go away between now and the fall. And so we're having a conversation that is inconsistent with the facts. And so we just need to get everybody grounded again in the reality of the situation, and that is we still have a public health emergency with an awful lot of COVID. And all of the active cases of COVID that we have in Louisiana today occurred while we've had restrictions in place, while we've been asking people to practice physical distancing and wear masks and do their hygiene and so forth. And so we just need to make sure that we are having an honest conversation and people know what's going on and that there are still risks out there of contracting this disease, and especially those people who are more vulnerable. You know, it is so disheartening to find out that you have people getting together to play a card game for hours at a time, and they're coming from different households. They're doing that in very close proximity to one another, and they're not wearing masks, and all of a sudden a big percentage of those people come down positive with COVID. And we've been having this message, and if you just watch what's coming out of Washington and the White House task force or the CDC and so forth, you know, we say it so often that we think it's being heard and understood, but that is obviously not the case. And so you have to amp it up on occasion, I think, in order to try to get your point across, and that's all we're trying to do. Yes, sir.
Governor, did you make a decision on whether to sign or veto the
No, but I suspect that the next time I see you, I will have made a decision, and you will know the answer to those questions, because I think my time will run out before you and I see one another again.
Did you sign the medical
Marijuana expansion bill that Larry Badger carried?
I don't believe that bill has been presented to me yet. And look, there are hundreds and hundreds of bills, and we take them batches at a time. And for the most part, we take them in the order that we receive them. And so I'll look at different bills every day, and I've got some more to look at later today. But I don't think I'll have a problem with that bill. Yes, sir.
apparently is showing John Carpenter the door because of, he said it was going to cost too much for the bill about the coastal lawsuits. Where do you think that stands, and what direction are you taking with it?
Well, look, Mr. Carpenter works and runs the Legislative Fiscal Office. Obviously, that's not part of the executive branch of government. And all I'm going to say is he's been a good and faithful public servant for a long time. I appreciate his service to the state of Louisiana, and I know, for example, that when I became governor and we had a $2 billion budget deficit, the largest in our history, the work of the fiscal office was incredibly important in order to allow us to chart a path forward that would eliminate those deficits and put our state back on a sound financial footing. We were able to do that because of his work and the work of all the people in that office who worked with him. But beyond that, I'm not going to comment. You know, that's certainly within the prerogative of the legislative leadership to do that. That's where Mr. Carpenter was employed, and I just don't. Well, the coastal lawsuits, well, they have been filed by the parish going back as far as 2013, 7 years ago. And as I've mentioned, they filed those lawsuits pursuant to statutory authority, state law that expressly authorized them to do that. And anytime they exercise the authority that they've been given, and those lawsuits have been pending for 7 years in some cases, I think it's wrong for the state to come back in and say, yeah, we know we told you could do it. We know that you did it. We know that you've got contractual obligations associated with this and so forth. But now we're going to tell you, you just go home and we're going to take it from here. I think that that's offensive to the way we ought to be treating local government and so forth. And so I was not in favor of those initiatives. It is the case that the Attorney General and my office, through DNR, have intervened in every one of those cases that were filed by parish governments, and I think that that's appropriate. That I, through DNR, and that the Attorney General would intervene, because I believe the state ought to have a presence there, and we ought to make sure that every dollar recovered, if any, goes to coastal restoration in the coastal zone of the state of Louisiana where the damages occurred. And so I think it is appropriate that the Attorney General and I intervene. I don't think it's appropriate that we take over cases that have already been filed and been pending and been litigated for some period of time. Yes, sir.
Governor, it seems likely we'll have a special session in the fall, most likely to deal with budget issues. If you could sort of include in that fall, reform efforts that a lot of started pushing.
Yeah, and if we're ready to go, and I had some conversations with some members of the House and the Senate on this, and of course I haven't yet engaged with legislative leadership, but I would want to do that as well. In fact, I always do that on calls that I issue for special sessions. I get with the Speaker and the President. We talk about when to come in, when we would adjourn, those things that ought to be in the call and so forth. I do think it's very likely that sometime around the 1st of October, we would come back so that we could get an updated forecast from the REC and know what the revenue's doing in light of whatever's happening in the economy at that time. I do think that we would also then take advantage of whatever additional funding might be made available by Congress. I was on a call with the National Governors Association today, and it appears that if it's going to happen, it'll happen sometime towards the end of July. And if there's additional funding in order to bring that to bear, we would have to have a legislative session in order to appropriate that money and then incorporate it into the budget and so forth. But if the folks who are working on these reform measures are ready, then certainly I think we could do that. There's also an effort, and I think you've seen resolutions filed, I think it was by Senator Fields, that indicates that the work may take a little longer, and he's calling for the commission that he's creating to work, I think, through maybe February of next year, and so obviously he's anticipating doing it in the regular session. But if the work can be sped up, and you're seeing this across the country now in states led by Republicans, led by Democrats, you see You see the House of Representatives in Congress and the Senate now, under the leadership of Senator McConnell, a Republican, all talking about police reform measures, and so we'll see where we are and discuss that with the leadership. But it's certainly something that I can see happening at the earliest possible opportunity when things are ready, and that could be October. It could be next April, I think, when we come back into a regular session.
Last one?
Yes, sir.
Just a few minutes ago, the Senate announcing they are having a shrimp boil tonight at the barracks. President Cortez's Senate barracks. You're pretty stern today. COVID's still in the state. Dr. B saying if you haven't been around somebody, don't go see your friends. I know the senators have mostly been together, but perception-wise and then safety-wise, is that the smartest thing to be announcing when you're telling them they're announcing?
Yeah, you know, I don't know exactly who's going to be in attendance there and what the rules are going to be, and so I don't want to venture into whether they're going to do that in a way that incorporates appropriate safety or not. You know, I hope that they will, and I do know that elected leadership at all levels plays a big role in whether we're modeling the behavior that we're asking people to follow. And so I would hope that they would. I certainly can tell you there is no CDC exemption from the rules for elected office holders. There's none for me. There's none for people in the legislature and so forth. And it is a very serious matter, and so we do hope that, and they're all friends of mine too, and so I would like for them to be safe, and I'd like for their families to be safe as well. But I would assume that if the president made that announcement, they're going to make sure that people engage in that. You said it's a shrimp boil? Yeah. Did they announce whether they were going to do curbside pickup? Okay. I would very much like to be able to participate via curbside pickup or delivery or something, perhaps. I haven't had good shrimp in a while. Look, thank you all very much. I expect that we will see you on Wednesday of next week, absent some intervening issue that would require us to call you back together again. And for the people of Louisiana, thank you again for all the hard work that you have put in. And we have made tremendous progress because of that hard work. It would just be very sad if we lost that momentum and actually went backwards after we fought so hard to make the improvements that we've been able to see and to enjoy. And when we talk about things being better and improvements, you know, we're still approaching 3,000 people who died in Louisiana from COVID-19. Still a lot of active cases out there, both tested positive and people who haven't been tested. And everyone should be very, very careful. And I'm going to finish with this. Most often when somebody tells me, well, they don't want to wear a mask, it's because they believe they feel well. And if they feel well, they don't think they have COVID-19, and therefore they can't spread it. Well, the problem with that is it's illogical. Because we know that 25 to 40% of the people with COVID-19 are asymptomatic, meaning they're never going to show symptoms, but they're going to have it, and they can certainly spread it. And I know there's some question about that, but go see what Dr. Fauci said this morning about that. The second thing is that people who become symptomatic, they can spread for 48 hours before that. And in fact, the viral load that they have, it may be at its heaviest 48 hours before they actually have the first symptom. And so if you wait till you feel bad before you put a mask on, there is every possibility you waited too long to protect the people who you're coming into contact with. Your family, your friends, your coworkers, and so it's illogical. And that's why we're asking people, don't focus on, look, I'm not mandating it because I don't think we can enforce it. But we shouldn't have to mandate something if it's obviously the right thing to do. And again, I'm asking people, don't focus on whether you have a right to say no. Focus on what is the right thing to do. And if you'll do that, if more people will do that, we're all going to be better off. So thank you all very much. We'll see you next Wednesday.